focus for the collaborative action strategy is starting with 5 antigens, so to speak: NTDs, malaria, vitamin A supplementation through the nutrition program, and then the polio and non-polio SIAs. And the goal is not to replace any intervention, so to speak, but rather to ensure that they are delivered in a more collaborative manner, more effective manner, ensuring efficiency of resources, human and financial, while still achieving the goals that they were set to achieve. So we know that health campaigns have been set in place because we're trying to we're trying to achieve coverage, and we're trying to crash some form of elimination, ensure some form of elimination or eradication or control. But there are different opportunities out there that if we could all look in-house and work together, we could be heading towards the same goal and delivering it more collaboratively in a more efficient manner. So it will ensure the strengthening of the health systems. It will ensure unburdening of the health workforce. It will also ensure sustainability and long-term achievement of health goals for the countries that are in focus. Neglected tropical diseases are efficient as long as the coverage is achieved. As far as you're able to treat those that you set out to treat, or to manage the situations for the case management NTDs, you're good to go. So it's not like the polio or non-polio programs where you have set targets and you have outbreaks and you need to address them at certain times. But at the same time, there's several opportunities for synergy. Neglected tropical disease addresses the people of the community, the poorest of the poor, those that don't have a voice. And there is this already strong network delivered from years of treatment, years of engagement that is already there. So we can never downplay the effect of a large force and a large community, and the community actually owning and accepting a program as their own. Neglected tropical disease has that. We also have the house-to-house that has been happening for years through the community-directed distribution method, where one of the champions for that was the onchocerciasis program. No longer control now, we're in the elimination stage, and we have reached elimination in certain states in the country. We know that it's neglected because they don't have as much funding as the immunization programs, and they don't have as much visibility. So, give or take, each has something to learn or to gain from the other. All we have to do is work more collaboratively, and then at the end of the day, something always boils down to the health facilities, something always boils down to the primary healthcare centers. For NTD